Okay, we are welcome back to my channel. This is Pencil and Eraser channel, also known as Beshama Entrepreneur. 25th to 27th of April are the days set aside to celebrate World Malaria Day. But actually, World Malaria Day comes up every 25th April. The theme for this year is harnessing innovation to reduce malaria burden and save lives. Now, after the celebration, dancing, a jamboree or whatever, it's like we have gone back to the default. The world has gone back to the default setting. What lessons have we learned from the last World Malaria Day? What innovations have we put in place? What new innovations do we have, or are we ready to imbibe to really reduce malaria burden in Nigeria, in Africa, in our world at large? And how are we using such innovations to reduce malaria burden and to save lives? Like I said in my previous video, you can watch it here, I said over 627,000 people died only in 2020 of malaria-related deaths. And of this number, we talk about the most vulnerables, we talk about the children under 5, we talk about the people that are immunocompromised, or immunodeficient people, we have pregnant women, and so on and so forth. So what measures, what new innovations have we put in place? And one of the new innovations I want our world to imbibe is self-testing malaria kits. It is also known as Malaria Rapid Diagnostic Test. So I will be showing you very soon, I'll be showing you the kit, I'll be showing you how the test is done. Why? Especially those that are into nursing, vending and pharmacy and so on and so forth. Not all fever are as a result of malaria, so it could be any other thing. So but you are the first line of care, you are the primary provider. When anybody is having fever or having any headache or whatever, the first point of call are these PPMVs and the retail pharmacies or community pharmacies. So you must be able to know how to do mRDT, Malaria Rapid Diagnostic Test. But it is either you do mRDT or you do microscopy, whereby you send people to lab. But it has been discovered that most of the people are averse to going to lab. They don't want to go to lab for tests. They want to tell you my baby is running serious temperature, and still telling me to take, except for few people. But if you have the test kit in your facility, it will enhance you. And not only that, you can report, you can have a place, you write the result down, you know whether it is positive or negative, so as to know the trend. Most of what we call malaria and really not malaria. So I'll be showing us how to do Malaria Rapid Diagnostic Test. Today we are demonstrating how to do Malaria Rapid Diagnostic Test using SD biosensor. This is one of the test kits in town, malaria, and it's to test for malaria Plasmodium falciparum, that is PF. So anywhere you see PF, it means Plasmodium falciparum. When you go to lab, they take your blood sample. What they are looking for is Plasmodium. Plasmodium is that organism that causes malaria. So when you are bitten by infected female Anopheles mosquito, it deposits this Plasmodium into your system. So when it gets to a stage between 3 to 15 days, you start manifesting the symptom. So this kit is to test for Plasmodium falciparum. We have about 5 strain or variants of Plasmodium. we have Plasmodium and Molessi, we have Ogbeni, we have Malaria A, we have Vivas, and we have Falciparum. But this Falciparum is the most common, and this is what we are testing for. So this is the test kit, SD biosensor. This test kit contain about 25 test kits. So we have the test kit, we have the buffer solution to test for the malaria. We have the swab. This is alcohol impregnated swab. This is a pipette, and this is a lancet to puncture your patient and collect small blood. So let's go into the demonstration. So what you need to do is you need glove. So you put on your glove. Put on your glove. We treat every fluid from human body as infectious. So you may have, so normally if you do it very well, you don't expect a spill, you don't expect to have blood stain anywhere, but it is important for you to put on your glove. So you bring out your buffer solution, you bring out your pipette, your swab, your impregnated alcohol swab, and your sterile lancet. So what you do is you bring just one out of it, then you bring your kit, your test kit. This is the test kit. So you look at it, it will expire by 2023. It is important to check the expiry date. So it will expire on the 4th of January 2023. So you still have a good test kit. So then what you do, then you need a wall clock that you use to time your test. So you'll be doing this for 10 to 15 minutes. So okay, let's go. So first bring out your swab. This is my swab. Then your patient or your customer is sitting down comfortably. Is this your right or the left hand? So it's better you use the left hand, because most people use their right hand. So if your patient is using left, is a lefty, use the right hand. Okay, she's a right-handed person, so you use the left, and you look at the ring finger. So what you do, you reassure your customers this will not be okay. Just a jump, and okay. You clean the finger very well. I like to dry because it's swab, alcohol impregnated swab. So after cleaning, I like to dry a bit. So you discard immediately. Okay, you discard immediately. Then you bring out your test kit. Bring out the test kit. So now you have to look at this. There is this silica gel inside the test kit. So if it is yellow, like you see here, it's still yellow, that means it is normal. But if it has changed color to green, that means it's invalid. So this is also very, very important. Though at times you may have the expiry date still intact, but it has changed from yellow to green, that means the kit is not valid. So these are very, very important to check. So this is the kit. So you place it on a good surface, then you bring out your sterile lancet. Okay, you come to the edge here, you puncture once. Okay, so you throw it away. Okay, now you bring your pipette. You have to clean the first blood that comes out, then you press again. You use your pipette to draw off, then you come to the test, or you put your pipette to soak up the blood. So you discard this immediately. That's the end of that one. Then you come to your buffer. You add four drops. 1, 2, 3, 4. So you cover. Then what do you do next? You label. If you have many people that want to do this test for, you label this place. You write the person's name. So you do it that way. But if not, your patient is waiting, you can just do that. Then you check your time from that minute. Now you allow the test to run for 15 minutes. So let's do some other things while we are waiting for the test to be ready. Okay, our result is ready. You can see we have only one line, so meaning it is negative. This line, as you see, C is the control line, whereas this PF is the test line. This is the test line, this is the control line. Okay, there may be a situation that you have a line here and you don't have a line here, meaning it is invalid. You have to check your test kit or you redo the test. Then I've seen people that instead of putting their solution here, the buffer solution here, they put it here. So you will not get the accurate result. So this is for your blood or your sample, and this is for the buffer solution. So if it is positive, you have two lines. The PF line and the C line must show clearly. So if this PF line is faintly, if it's shown faintly, you still have malaria parasite. And one issue with this mRDT is that if a man has taken malaria drug, maybe a day or two before coming to your facility for test, it may not, this mRDT may not pick malaria parasite, the falciparum in the blood sample. So then if you do it and you are very sure the person may be having malaria, what you do is to send the person to lab where they get the blood and do tests. They do microscopy tests. So they have different type of stain in the lab that they can use. But as it is negative. So you may give your customer or your patient paracetamol, Bico and some other thing, and ask them to sleep very well, let them eat very well. So but if the symptom persists, so that you send them for microscopy tests, that is send them to lab where they take their blood and do further tests to confirm whether they are they have malaria parasite or not. But this is simple demonstration of mRDT. So mRDT, Malaria Rapid Diagnostic Test. So let me know what you think about this procedure, about the video. So if this video has gained anything from this video, I want you to share it. I want you to tell your friends about it. The time is coming, just like a urine test, pregnancy test. This will become very common everywhere. Everybody will be able to test themselves before going to buy malaria tablet or not. So thank you very much. Like this video, share it, subscribe to my channel, and hit the bell notification to know when I drop my next video. So thank you very much. Once again, this is Beshama Entrepreneur, also known as Pencil and Eraser channel. Thank you. See you soon.